Good afternoon, and thank you for standing by. All participants will be on a listen-only mode until the breakout sessions. This conference is being recorded. If you have any objections, you may disconnect at this time. I would now like to turn the call over to Ellie Stout. You may begin.
Thank you, and good afternoon, and welcome to SPRC's webinar, Supporting Schools After a Suicide, Strategies for State Suicide Prevention Coordinators. My name is Ellie Stout, and I'll be your moderator today. And it looks like we still have some people joining us. We have about 30 people so far, and we welcome all of you. We're so glad you could be part of this event. Today we'll be starting with a brief orientation to Live Meeting, which is the webinar platform we're using for our event today. Next, we'll introduce our facilitators, and we'll also find out a bit more about who is joining us today from across the country. Shel Gross and Brenda Jennings will then share some of their experiences with school postvention in Wisconsin. And then it will be your turn to share your challenges, successes, and strategies. We'll be breaking out into 5 virtual discussion groups for brainstorming and conversation with your colleagues and peers from different states. And then we'll bring some key points from each of those small discussions back to the larger group. Just a quick note that we will be recording the larger group portion of the webinar, and we have folks taking notes in the small group discussions, and we'll be posting those materials as well as a list of related resources on our website in the next few days. So don't feel like you have to write everything down. You'll always be able to refer back later to what you've seen and heard here today. So first, for those of you who haven't used Live Meeting before, we'd like to give you a brief orientation. As the operator mentioned, except for when we're in the breakout rooms, your telephones will be muted to prevent background noise, but that doesn't mean that you can't participate in the rest of the session. The first feature I'd like to point out is the Q&A pane, where you can type in a question at any time during the meeting. And that's the question and answer pane that you see up at the top menu. You can click on that to open a Q&A window in your screen like you see here, and type in your question to that box and click Ask, and then we'll see the question and we'll be able to answer it, or we'll save it for a Q&A moment with presenters. You'll also notice that there's a raise your hand feature in the upper right corner of the Q&A box. You can click on that and you'll see that your hand gets raised, and there's a little orange background behind it. And to put your hand down, you'd click on it again and there won't be an orange highlight in the background. And if we see your hand raised, we'll chat with you directly to see what your question is. There's another way you can let us know how the meeting is going for you. If you look for the feedback tool in the upper right hand of your screen, I'd like to actually ask you to go ahead and click on the arrow next to the little green box that you see, and you'll see there's a drop-down menu of sort of different status, and go ahead and change your status to the yellow, which here means welcome, just to try it out. And I see a few of you have found it. And if any of you have the attendee list open, you can see that everyone's now changing to yellow. So there are other colors on here for slow down or can't hear, or indicating that you have a question. So feel free to use this as another way to give us feedback if you have any trouble in today's event. I'm going to move on, even though some folks are still experimenting with that. We'll also be doing a few polls today to get a better sense of your roles and some of your experiences. And the poll will show up in the center of your screen, just like the PowerPoint slides are right now when we pull it up. And when we bring up a poll, it'll look something like this little one sample that I've developed. And you can only click on one choice. In this case, you can see there are some similar choices available to you. So we just ask you to click on the choice that best represents your answer to the question. And then once everyone's voted, we'll close the poll, and you'll be able to see the percentages on the right-hand side showing how everyone voted. And we'll experiment with a poll in just a moment. Finally, I wanted to let you know how to ask for support. This is actually the direct website and toll-free number for Live Meeting itself, the makers of the program. So if you're having any technical difficulties, they can talk you through any trouble you're having connecting to the meeting. Now that we've walked through how you can use our webinar platform, it's time for some introductions. We are very pleased today to welcome two colleagues from the state of Wisconsin who will be sharing their experiences and also co-facilitating with us today. Shel Gross is the Director for Public Policy for Mental Health America of Wisconsin, and he also serves as co-chair of the Wisconsin Coalition, which is called Prevent Suicide Wisconsin. Brenda Jennings serves in many different roles at the Wisconsin Department of Public Instruction, but today she'll be wearing her hat as Suicide Prevention Consultant with that department, and I'll be introducing both of these colleagues in some more depth when they speak a little later on. And my name, as I said, is Ellie Stout, and I manage the prevention support team here at the Suicide Prevention Resource Center. And we also have two other prevention specialists from SPRC with us today who will be facilitating breakout rooms. Smita Varia is a prevention specialist working from our Washington, D.C. office, and Carrie Smith is one of our campus prevention specialists, and she works up here in the Boston area with me. We also wanted to show you who else is joining our event today, and as you can see from the shaded states, we had quite a lot of people sign up for the webinar representing various states and communities across the country. In total, over 70 participants registered, and we're still getting up there. It looks like we're getting close to 40 folks who are actually joining us so far, so welcome to all of you. And to give you a better sense of just who is joining from each of these states, we'd like to ask you to vote in our first poll. So Tiffany, if you can pull that up. So click on the button identifying the role that best represents what you do for suicide prevention in your state or community. And I know many of you wear many hats, so I just ask that you pick sort of your main role that you serve. I'm going to let people vote for a few more moments. Okay. If you can go ahead and close the poll, Tiffany, and show us the results. So most of you, it looks like, are working with state agencies to lead suicide prevention efforts. We also have some folks working for nonprofits, and then we also have some state and local coalition members, which is great, and a couple of other roles as well. So I want to thank you all again for joining, and I think some of the diversity that we see here will be really interesting when we have our small group discussions. So if we can go back to the presentation. So let's get started with today's content. And to start with, just a reminder, as you saw in the email announcement, today's objectives include learning strategies and getting ideas about how to effectively and confidently respond to and support schools in your community or state who have experienced a suicide. I wanted to mention that this webinar is meant to build on a webinar SPRC did last month entitled Responding After a Suicide, Best Practices for Schools. And in that webinar, several speakers and experts talked through research and best practices for postvention in school settings. And I may be overusing the poll function, but I wanted to get a quick sense through our next poll, if you could pull that up, Tiffany, of how many of you attended that webinar. It was back on May 26th. I'll just give people a few more seconds to vote. Okay, Tiffany, if you can close that and show us the results. So great. So it looks like we're actually somewhat evenly split. It's great to see that so many of you were able to participate. For those of you who were not able to attend that webinar, no worries. It will be included on the resource list that we post on our website for this event, and it's actually already up on the SPRC website. So if we could go back to the presentation, I just wanted to mention a new resource that we highlighted in that webinar to be sure that everyone was aware of it. This is something that SPRC and the American Foundation for Suicide Prevention recently developed, and we hope it will be a useful tool for you and for schools directly in the immediate response after a suicide has occurred. Our speakers today were a bit ahead of this national level work and developed their own toolkit for school prevention and postvention in their state, and they're going to speak a bit about their experience using the toolkit and responding to schools. So before they share their experiences, I'd like to more formally introduce Shel Gross and Brenda Jennings. As I mentioned before, Shel Gross is currently the Director of Public Policy with Mental Health America of Wisconsin. He was the project manager of the Wisconsin Garrett Lee Smith Grant from 2006 to 2010, and he's also managed a state prevention grant from 2000 to the present day. Shel is also the co-chair of Prevent Suicide Wisconsin, which is Wisconsin's statewide coalition, and he also formerly served with the Wisconsin Medicaid program as a mental health and alcohol and other drug abuse policy analyst. Brenda Jennings serves as alcohol, tobacco, and other drug abuse consultant and suicide prevention consultant at the Wisconsin Department of Public Instruction, where she also serves as Safe and Supportive Schools Project Officer. She currently serves as a member of the Prevent Suicide Wisconsin Steering Committee and was a Suicide Prevention Coordinator at Mental Health America of Wisconsin. Brenda has 10 years of experience in schools, including as a teacher, counselor, alcohol, tobacco, and other drug abuse coordinator, and as a coach. So welcome, Shel and Brenda, and I will turn it over to you.
Okay, thanks. Oops, am I going the wrong way? All right. Thank you, Ellie, and thanks to all of you who were able to join us this morning, this afternoon. I also wanted to show you our state brand for Wisconsin, Prevent Suicide Wisconsin. That's one of the things we've done in our state to get some cohesion to our efforts, and many of our local coalitions have used that as well. So I really wanted to start out talking today. We had a chance to review some of the comments that people sent in prior to the webinar in response to questions that Ellie had sent out. And really, our experience in Wisconsin is very much like what was reflected in the comments that came in. The main reason we developed guidelines here is what I think are the reason many of you are interested in doing so, is that we got calls and nobody was really sure what to do. And the calls went into lots of different places. They might have come to an agency such as ours or another private agency in the state. But a lot of times they went to state public health, mental health, to the education agency. And as those of us who were involved in developing the Wisconsin suicide prevention strategy were talking, we realized all of us had fielded calls like this, and we're not sure really what sort of information to give schools in the wake of a suicide. The other things that we really have in common that a number of you expressed in your responses was that schools are reluctant to call and seek help. And in fact, the rule is going to be that you're not going to hear about a suicide right at the time or even within a few days of when it happens. You're much more likely to hear about something a bit further down the road. And we'll talk about using the toolkit and the guidelines when you do get those calls right away and why that's helpful. But we'll also talk a lot about what you'll want to do and how you want to use this material when you get calls later. We also see inappropriate school responses because schools also don't know what to do. Lack of protocols at the school level and lack of knowledge of or connections with local resources that actually could be very helpful to schools if they had those connections. And one of our important goals, and part of the reason our guidelines are for prevention and intervention as well, is we want to really work with schools and provide them guidance on developing response plans so that when something happens, they're ready. They've got things in place. The guidelines work, and the real reason they work is that you have something to offer to people, and it reduces the burden on those of you who get the calls. As I note here, don't underestimate the value of a checklist. Very often, that's what schools are looking for. They're looking for what should we do about certain topics, and Brenda's going to talk later about some of the specific questions. They're looking for some of the templates that you'll find in the toolkit about how do we make an announcement, how do we deal with this. It's like some other situations we have. It's also not like those other situations. So some of the templates and checklists that are there are exactly the sort of things that schools are going to be looking for, and it empowers them to take action without being concerned that somebody from the state or private agency is going to come in and take over the situation. A lot of times the reasons you don't hear from schools is they're concerned about sort of losing control over that situation. And again, I just want to underscore addressing prevention, intervention. One of the things we found now as we work with schools and talk with them about crisis plans is a lot of them will say, well, we have a crisis plan, but probably nobody's ever seen it. And if they have seen it, it doesn't necessarily address suicide prevention. So, we really encourage you to look at, the full range of materials to have available to schools because if you have the opportunity to work with them after a suicide, you want to also build in some of these other pieces for them. I'm going to turn over to Brenda, talk a little bit about the perspective from the Department of Public Instruction.
All right. Thank you so much. And thank you, Ellie and SPRC, for having us. I just wanted to give a little background as well. With our Wisconsin toolkit, it really has helped with response at the state level. And just to give a little background on how this started at Wisconsin DPI, or our state educational department, we had a state mandate to provide assistance to schools with suicide prevention programs. And, as we see in the response that we kind of responded the same way, like how are we going to go about doing this? So we hired a research specialist back in 2000 to help with research review of programs and best practices. And from that, we put together a best practices guide and also trainings to help with schools in Wisconsin. And this is a slide on the YRBS, the Youth Risk Behavior Survey. And I know a lot of states use this, but I just wanted to highlight that we used our statewide data on the YRBS as well as the national data results to help us paint the picture of the need in Wisconsin for suicide prevention. So Wisconsin youth suicide prevention laws, we look at data and we also are driven by the laws. The Wisconsin state laws around suicide prevention are that schools must have suicide prevention curriculum that address all of the students and that work around suicide prevention. At DPI, we have created a curriculum based around SOS from Screening for Mental Health. And I can talk a little bit about that in a little bit. Another law is DPI provides districts with a model notice on suicide prevention resources, and this gets sent out to all of the districts, and we encourage the districts then to in turn send it out to all of their staff annually. And this is just an update on the resources, both local, state, and national. Another law is that DPI must provide training and technical assistance to schools, and we do that in outreach, and I'll show you a slide here in a minute on how we offer that training in the field. We also have a civil liability immunity law, and this allows school staff to be involved, and they don't have to worry about being sued individually if they're going to attempt to help someone in a crisis situation. So our DPI training modules that we have developed, and the toolkit has really helped us in that, is a day-long training on suicide prevention. In part one, we start off with incidences, risk factors, warning signs, essentially gatekeeper training. We also address the curriculum. We have curriculum that goes out to middle schools and high schools, and this is also available on our website. And part two of the full-day training is on prevention and intervention programs. We actually walk people through the strategies, what they can do for prevention-type programs and intervention-type programs. So now we are able to respond to schools, and we feel like we have some background and we have the resources available that we can offer these trainings on a regional basis. We also have a webinar available on our website for gatekeeper training. So any of the school districts can call or just use the internet and look it up on our website and use the gatekeeper training. We also have a mental health toolkit training that we offer along with the suicide prevention training. And we have a number of resources available on our website. And of course, we work closely with Mental Health America and other partners to offer these trainings and resources throughout our state. And I'll turn it back over to Shel.
Thanks. So I think, really a key concept that we want to get across is that you want to actually be proactive about postvention. Given that the reality is that schools are going to be reluctant to call, the more information you get to get out to schools beforehand, first of all, they're going to have that information, so they'll be able to use it even if they don't call you. But secondly, they might then see you as a resource and be less hesitant about calling because they said, hey, these people have some information, maybe they'll be able to help me with this other question. And so, Brenda's really outlined a variety of ways you could do that in terms of, they've been able to put together the trainings. You may be able to do something like that. You could have a webinar such as this for people in your state. You can disseminate materials. There's a toolkit now that Ellie talked about earlier. If you did nothing else but sent that out and say, hey, take a look at this, make sure, key staff have this available, that's going to be in their hands. And then if something happens, they in fact may use it. Shortly after we developed our Postvention toolkit, one of the members of the team who helped put it together, they had a death in their school. It wasn't a suicide, but he said he used it because it worked well, and he said it was really helpful just to have those checklists because when that happens, people get pretty upset. There's a lot of stuff going on, and it just helps structure their thinking about what to do. We also, in Wisconsin, did a school bulletin with DPI, and we contracted with an organization here in Wisconsin, Points of View Communications, to create the Well-Aware School Bulletin. And it was really persuasive communications to schools. It was developed really for school administrators and principals, superintendents, to try to get them to understand why was it important for them to be thinking about suicide prevention. What did that have to do with what they saw as the main goal of schools, which was to educate kids. And if you go on our website, the MHA Wisconsin website, you can find the 3 issues that we did there. But a number of states have also been working with Point of View on developing their own newsletters, websites, and webinars around that sort of branded kind of theme. So doing that kind of educational stuff, again, it's a way to get information out to schools maybe before something happens, but also they start to identify you as a resource for them. The second thing I think that's important as part of this is looking at the full community response. And in Wisconsin, we're a very county-oriented human service state, so we base a lot of our work on developing local coalitions, and we encourage them to include and work with schools. And it's very helpful because they both can support schools in what they're doing. There may be some people within the school who want to do more around suicide prevention, but they're getting resistance from administrators who feel like it's more than they can take on. And if the community is saying, well, this is important, that really helps to motivate the schools to do that. But community is also part of the response. And again, we're fortunate in Wisconsin. We have a very well-developed crisis network. So each county has crisis teams. And if schools are connected with them, those are really the people who are best prepared to go in at the time of a suicide and provide support to the people in the school and the people in the community following a suicide. So we really try to work with them, develop those connections. But they could also be connected with others in the community from the medical systems and mental health and substance abuse systems, public health, who can also help them and provide support when there's a need for response. And the bigger question here, the bigger piece, is really creating this long-term infrastructure change so that suicide prevention is supported across the community, including in schools, but also with all these other agencies. And so creating those partnerships is a big part of what happens through our local coalitions. And that can also, I've mentioned the number of partners, but also law enforcement, who often get called if there's been a suicide or another type of incident. So the more all these partners are involved in communicating with each other, have thought proactively about what their roles are in response to a suicide or a mental health crisis, so as to prevent a suicide, the more likely the whole community is to be able to respond in an effective and efficient manner. So, this, you may have thought you were calling in to hear about, responding in the immediate aftermath of a suicide, but I think all of us are aware that the important work we have to do is really this prevention work and creating communities that are going to be able to act together in a proactive way to both prevent and respond very quickly. So I think, do we have a poll now?
Yeah, Tiffany, if you could bring that up.
So we did want to ask you, actually what we want to ask you is all the agencies you're involved with, but we can only do one response. So which agency or organization are you most engaged with around suicide prevention and postvention in schools? Okay, a number of you didn't even wait for me to start talking before you answered. Great. Okay, there's supposedly 40 of you on the line. Let's go.
It's probably hard to choose. Why don't we go ahead and call that a day, Tiffany?
Okay. So the results are, obviously education agencies are one should be involved with quite a bit with regard to schools. But it's good to see that a lot of you are involved with the mental health agencies, and a lot of you also are working with local coalitions on that, and I think that is an important way to go, and the crisis response as well. So, those are obviously all pieces that you want to have involved, and my guess is many of you are working with multiple ones, and had we been able to reflect that in some way in the poll, we would have done that. So now, for the moment you've all been waiting for, Brenda is actually going to talk about, from her position working at our Department of Public Instruction, what does she hear when she gets calls from schools?
Okay, so I think, first of all, schools are reluctant to call. I think they feel like they have to handle it internally. They have pupil services staff. They have administrators. So I think they think that they have to handle it internally, or it may be a sign of weakness if they call. But actually, when people do call, they tend to find that they get a lot of information, a lot of resources. The first question that I receive a lot on is how to address memorials, how to address funerals at school. And I do use the Toolkit a lot. We have a lot of resources on our website. I refer them to those. I refer them to the most recent research on this. And it's really nice to have those materials available. People can use it. They're in formats that are just user-friendly. They can print them off and use them in their schools or with parents and families. The second question, our most common concern, is they want resources. What can I use in schools? A lot of times they don't have a lot of time to read through and sift through a lot of information. So they want something succinct, something usable. Like Shell said, checklists are just wonderful, especially in schools when people are, wearing so many different hats, and it's just nice to have a checklist and check things off that they've covered things. So those are really helpful. Then the third thing is the trainings. Schools usually call and they want resources, or they want to know when's the next time that I could get trained or send staff to training. And so it's helpful to have this toolkit that we've and module that we've used to have trainings and that we've modeled it after, and we keep updated on the latest research. And it's easy to update something that's already in existence and just continually updating that. So just trying to wrap up here so we get this completed in time. I think the key is to help schools understand that they don't have to do this alone. This toolkit will help them identify resources statewide, nationally, as well as locally. So I think at least the toolkit has been very helpful for us here in Wisconsin, and hopefully it will be helpful for you as well. All right, I'll turn it back over to Shel.
Yeah, so I just wanted to briefly give a real-life example of postvention in action. And this is one of those situations where I didn't get a call specifically around, we've had a suicide, what do I do right now? I got a call from a small community in west central Wisconsin that had 2 recent youth suicides. And they were really wondering, what do we need to do so we don't have more of these? And the reality is a lot of communities, as many of you probably know, are not going to do anything before they have a suicide. And so postvention is the prelude to prevention. And for better or for worse, it's the opportunity and it's a time when people are motivated to do something. And so I got a call from somebody in public health who had heard about us. She contacted actually the regional public health office, and those people had been involved in some of our activities, so they knew to contact us. And that's been one of the nice things about the work that we've been doing. Not only do we know what to do, but a lot of people in the state now know where to send people, who the folks are who are working on this in Wisconsin. And they, as I said, had 2 youth suicides in a fairly short period of time, and we're wondering what to do. And so I got contacted, as it notes here, initially in mid-March in 2009, and I was actually able to attend the next meeting of their stakeholder group in early May. And they had put together a team of folks that included public health, emergency government, mental health, law enforcement, schools, some people from their medical sector, and a couple of other groups. And we had created a youth suicide prevention toolkit. I say we. It was Brenda mostly when she worked with us. And Brenda also created a very nice PowerPoint that sort of walked people through that. And so I was able to walk through, here are the different kinds of things you can do, from gatekeeper training to the curriculum piece, SOS program, a lot of the things that you folks know. And then they were able to, within a couple of weeks, contact me and say, what we want to do is outreach to the community about the Suicide Prevention Lifeline, which they were able to do. We'd like to do QPR training for our school staff, and we were able to get our suicide prevention coordinator down to their community in August to do that, and they wanted to implement SOS in the schools. And both DPI and our agency have been hoarding SOS kits whenever we had a little money left at the end of our grant year, so we were able to send them some kits so they could get that started. And so it's really within a very short period of time, they put together, a very nice plan for starting suicide prevention in their community, and they actually are continuing with their efforts to this day. So being prepared, having this information allowed us and will allow you to respond in a very helpful way to communities who are experiencing these issues. And I think we're like a minute over, sorry.
No, that's perfect. So thank you so much, Shel and Brenda, for sharing some of your experiences and insights around both postvention and prevention work with schools. And we have one question that came in while you were talking, which was, can you spell out the acronym SOS program?
Oh, SOS is a Signs of Suicide program, and that was created by Screening for Mental Health, and it's a gatekeeper program for youth. It's a video, and it kind of teaches them the correct way to respond to a friend who might be suicidal. And actually, DPI, their curriculum around suicide prevention is modeled after that and incorporates, they work with Screening for Mental Health to incorporate a lot of the concepts.
Great. And if folks have any other questions for Shel or Brenda, please go ahead and type it into the Q&A box and hit ask, because we did set aside a little bit of time before we go into our breakout groups. I'm going to give it like another half minute. Oh, there's a question. What's DPI?
DPI stands for Department of Public Instruction, and it is Wisconsin's state educational agency.
Thank you. And then there's another question around the toolkits. Did you basically just give them all the things they could do and then let them choose?
If this is in response to my story, yes. And that's generally how we approach it. We try to share with them what we know works, and then we'll work with them now when we're able to, and we're able to spend some time with the coalition. We'll talk with them about who's involved, what agencies, because that may dictate things. Sometimes you'll do things based on who's around the table, who's willing to roll up their sleeves, and that may dictate what you could start with. But a lot of it is we want to really empower the local coalitions to figure out where are the places they want to start, what are the things that they think make sense for them, recognizing you start somewhere and then hopefully over time build in other things.
Great. And there's a follow-up to this from that person. In giving them the ability to choose what they have in their program, do you find that they are more open to working with you?
I think so. Brenda?
I think so, definitely. Giving them a wide variety of options to choose from allows them to look at what are their strengths and what are their weaknesses and what are some things they can work on. It gives them the flexibility to adapt the program for themselves.
Great.
And keep in mind that when we did our toolkit, we've already weeded out stuff. So we're presenting them those things that we know have been shown, like on the SPRC best practice registry or stuff like that. So we're already giving them a list of things to do that we've edited and tried to simplify and organize. Because one of the things we learned early on was it was very overwhelming for local people to come into this world of suicide prevention and try to figure it out. Mm-hmm. And really the goal of the toolkit was just to try to help organize their thinking.
Great. Well, we had a couple other questions, but I'm going to save them for if we have some time at the end, because now it's time for the fun part. So hold on to your hats. Oh, sorry, that was my slide for the Q&A. So we're going to now go into 5 virtual breakout rooms to discuss and brainstorm your challenges, ideas, and strategies in postvention work with schools. And this is where we'll be using the worksheets that we attached on Friday to your webinar confirmation email. So if you're able to fill that out, keep that information handy. And I'm just going to explain what will happen. When you joined the event, the operator asked for the state you were joining from, and you can see here that we've assigned breakout rooms by state. And when I give the word, the operator is going to put you into your virtual breakout room. And we'll be breaking out into audio breakout rooms only, so it's just what you hear that will be separate, and we'll all still be able to see the main slide area. We've put about 20 minutes aside for the discussion, and once we're in the rooms, everyone will be unmuted, and the facilitator, who's listed here in parentheses, will be leading the discussion, but we hope that most of the talking will be all of you. And towards the end of your 20 minutes, the facilitator will ask your group for one main idea, strategy, or thought that you want to share with the larger group. And then when it's time to come back to our main room, we'll be able to share what each of the different groups discussed with the larger group. So nothing that you have to do yourself. We'll take care of all of it in the background, but I just wanted you to know what would happen before it happens. And hopefully while I've been talking, you found your state on one of these lists. So I'm going to go ahead and ask the operator to put us in our rooms now, and we'll see each other back here at about 4:37 or so in about 20 minutes.
Okay, thank you. It'll be just one moment.
Hello, is everybody in the room?
Hello?
Yes?
One moment. We'll let you know when you're in your separate
Okay.
room. One moment, please.
We should be ready to bring everybody back by 4:35.
Okay.
Tiffany, can you hear me?
Mm-hmm.
Oh, gosh, I'm so sorry, everyone. I figured they'd be like, no, you're back in the big room.
Oh, she was supposed to. I think.
Oh.
Is everybody back in the room right now?
Belle?
This is Brenda. We're back.
Hi, Brenda. Oh, they must be fetching everybody individually. Great. We'll give them all a chance to get back then.
Carrie is asking if she could be back into the room, but I don't know if that's happened yet.
Oh, they should be getting her in her room.
Carrie, are you back in the room now? I think she's just about to.
Okay. I want to thank everyone for your patience. We have not done the breakout room thing before, so we weren't sure what to expect.
Okay, this is operator. Everybody's back in main conference.
Wonderful. Thank you. So welcome back, everyone. I think we're all back in the main room here again, and I'm sure, as in my group, everyone had a great conversation going. So I'm sorry to yank you back out of it, but we wanted to save a little time to share at least a few small things that each group talked about. So starting with room 1, Shell, what did your group have to share with a larger group?
Well, I think the big issue is the one we talked about earlier was resistance from schools in terms of being involved. And I think one of the things that came out in terms of some of the examples was really being ready to respond as best you can when schools do call. We can't necessarily make them be involved with us, but if we're ready, and some of that, may involve just figuring out who can do what. If there was a concern one person had, they're not the mental health expert, and that's fine. I'm not either. So who is the person you can bring in? Some people talked about who they were able to mobilize in the communities that could really fill the different roles. So to the degree that people can plan who they could call on when something happens and at least be able to respond when people are ready, that's going to make for at least responding to what comes up, even if, if you can't make the horse come to the water. When they do, you can give it something to drink.
Great. Thank you. Brenda?
I have to follow that analogy.
That should be easy.
Well, I had a great group, and we had some great discussions. I think what we kind of came to a conclusion that, a lot of people didn't have anxieties about schools responding or people having concerns, but we do notice that schools have anxieties, and they're particularly looking at the blame from parents or from the community. But we just need to remind them that this is not just a school issue. It's a community issue. It's very multifaceted, and we need to work on this large challenge together.
Great. Well, this is Ellie, and I was facilitating the third room, which had such a fascinating conversation that we didn't really come up with something to share for the group, but I will share that we did talk also about resistance from schools and parents to some degree. We also talked about administrators and school boards being concerned about liability issues. And then right as we were wrapping up, a colleague from Texas was actually outlining what I thought was a really great infrastructure that she coordinates, but that really exists at the local level through coalitions locally and local mental health authorities. And so I just wanted to flag that as something really important that Shell and Brenda also talked about, is the importance of those local connections and how those people then are in a good place to help respond because they really know the local situation very well. Smita, what did room 4 have to share?
Hi, everybody. We had a good but small but good group, and I thought I was going to be able to give feedback on all the questions, but now I realize I had to summarize it all. So one thing to echo what all of you have said so far is the importance of the community. And we talked about coalitions and definitely making sure that community members are a part of those coalitions, and working with the local crisis centers. And then one of our states also has resource guides available for all the schools that lists out the resources and the counselors that are in that state or that are in that region if something happens at the school. So to have those resources readily available is also very helpful.
Great, thank you. And Carrie, how about room 5?
Great, thanks. So we had a great discussion, and one thing that really struck me when I was listening to our participants in this group was everyone there felt pretty comfortable responding and didn't have a lot of fears or anxieties, much like Brenda mentioned about her group. But one of our participants made the point that it's really tempting to possibly respond using your own skills that you have, but it's really important to think about the postvention response as a statewide effort, which I think is really important. We also talked a bit about how others have kept their State Department of Education involved, and a lot of times this has taken some time and having to get invited to meetings here and there, and it just is a continual effort. We also talked a little bit about some strategies for getting schools involved, and one state goes to professional organization conferences like the NSAW conferences and share their work there, and just a lot of different strategies.
Great, thank you. Sounds like everyone had good conversations, and again, we'll be sharing more complete notes from all the small group discussions when we post the webinar on our website. So now I am going to turn it over to Shell for our sort of closing exercise.
Okay, well, there's your instructions. So what we want to hear from you is, based on the conversation today, what do you think your next step is going to be? What can you take out of here, this discussion today, and turn into an action? And we're just going to ask you to use the Q&A function on the screen to type in a response, and then I'm going to read some of those off. So just go ahead right now, and if you can say something about what you think you might want to do, you're not going to be held liable for actually completing these objectives in a certain time period. Just your initial thoughts about what you'd like to do, maybe a conversation you want to have with somebody you haven't thought of, or going to a website. Okay, so we have reach out to my State Department of Education, look into local support groups and grief centers. That's a good idea. That's, again, what are the resources available that you might be able to tap into. Introduce the model toolkit from Wisconsin to neighboring school districts in Michigan. As we talked about earlier, simply getting this information in people's hands so they have it, and maybe somebody will look at it and do something with it and call you back. Sharing the notes of the meeting with team leaders to utilize. Maybe develop your own toolkits. Great. Look at state guidelines. Ask to attend county superintendent meeting and discuss prevention measures. Great. Yeah. Develop relationships. Get to know people. Yeah. Similar. Have a dialogue with city, county health departments to share our community toolkit for postvention. It's always a good idea to look at who are your partners, who your natural partners are that are located locally. Some of them may have relationships already with the schools and just don't have this part of it there, and they can carry the water for you a little bit. Put together packets for schools containing information checklists, what's offering education sessions. And, of course, the toolkits are there already, so you can use those. You can adapt them however you like. Formalize our recent postvention funding to formalize the process for assembling and distributing training and materials. That'd be great. Give a little more time if you're still thinking or you're trying to listen and type at the same time. I'd like to plan a suicide prevention conference for principals. Put success stories together and send them with the toolkit. Nice idea. Formalize our recent postvention funding to formalize the process. Oh, I read that one already. Begin meetings with our State Department of Education. Great. And I hope everybody has people like Brenda in their State Department, because then you'll have great meetings.
So, Shell, I'm wondering, as those continue to trickle in, there were a couple of other questions that came in when when we were doing our Q&A with you and Brenda, and I'm just trying to look at them since we have a bunch of questions in there now. I think, let's see, there were a couple of questions about model checklists and whether the toolkits are available online. And I just wanted to let people know that we will include the Wisconsin toolkit link as well as the link for the SPRC AFSP toolkit that I mentioned in the resources sheet that we'll post along with this webinar. And then it looks as though there are some training-related questions, but I'm not sure that they're necessarily relevant to our topic today. I guess there was one relating back to the SOS training about whether whether schools mandate training for all staff before SOS is done for students.
Brenda, do you want to respond to that?
Well, it's not a mandate. There is a mandate that schools have to use some type of suicide prevention curriculum with students within their K through 12 career. But we just provide them with a free curriculum that we've developed along with SOS and screening for mental health. But it's not a mandate that they have to use SOS. It's just one example that they could use.
Okay.
We really do encourage schools, and if they talk with us, we talk with them about, if you do this, how are you going to respond? Are your teachers going to be able to really recognize and respond if kids come up and say they're feeling suicidal? So we really want them to think about what sort of training should their staff have, what are their response policies, what are their connections with mental health professionals in the community, so that they can respond when they implement these programs.
Great. Well, I think that folks are already sort of signing off, so I'm going to go ahead. Thank you, Shel and Brenda, for answering those last questions. I want to thank all of our facilitators, and especially Shel and Brenda. It was great to hear about your experience and insights, and I want to thank all the participants, because it was great talking with all of you in the breakout sessions. So this is how you can get in touch with all of the facilitators today, and I've also included the link to the SPRC website. We will be posting all of the things we've been talking about today. And I know many of you were interested in the small group discussions, and I want to remind you that there are contacts on our website for all of the states and all of the Garrett Lee Smith grant programs. And so I hope you'll continue to seek out and connect with your peers and colleagues at the state level especially, so you can continue to share resources and learn from each other and connect. We do want to know what you thought about this event today and whether it was helpful for you. So a webinar evaluation invitation should be waiting for you in your inbox as soon as you get off the call. And we hope you'll take a few minutes to provide your feedback so we can continue to improve for future events. And that concludes today's event a little early. Thank you all for coming, and we hope you have a wonderful week.
Thank you. This concludes today's conference call. You may disconnect at this time.